This is Dr. Muskan Kaushik, and today we are going to take the topic reproductive and sexual health problems. As per WHO or World Health Organization, reproductive health can be defined as a state of complete physical, mental, and social well being, and not merely the absence of any disease or infirmity. And in all matters, it is related to the reproductive system, to its functions and processes. Okay, so reproductive health does not only mean that the person is physically healthy or mentally healthy or socially healthy, but it needs the participation of all these three aspects. Then only the reproductive health will be there. If any of these three is affected, then in that case, reproductive health will be compromised. Reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do the sexual activity. Now, the ability of a man and woman to achieve sexual health and well being depends on their access to comprehensive good information about sex and sexuality, knowledge about the risk they may face, and their vulnerability to adverse consequences of unprotected sexual activity, ability to access sexual health care, and the living in an environment that affirms and promotes sexual health. So, if any of these factors is not there, then yeah, reproductive or sexual health will be compromised. Now, if we talk about the sexual health issues or the reproductive health issues, they are wide ranging and they encompass sexual orientation and gender identity, sexual expression, relationships, and pleasure. They also include negative consequences or the conditions like HIV, sexually transmitted infections, reproductive tract infections, and their adverse if outcomes like cancer or infertility. It also includes unintended pregnancy and abortions, sexual dysfunction, sexual violence, and harmful practices such as female genital mutilation. If you people have any query, then you can stop me in between or we can take it in the last. Reproductive and sexual health problems include, so basically in today's lecture, we are going to take these following topics into consideration for the reproductive and sexual health problems. This includes endometriosis, uterine fibrinoids, gynecological cancers, HIV AIDS, interstitial cystitis, polycystic ovary syndrome, or we also name it as PCOD or PCOS, and sexually transmitted diseases. All right. Can anybody tell me what are the linings of the uterus? How many linings of uterus are there? Come on, people. You people are from MBBS backgrounds. These are tiny, tiny things. Nobody knows about uterine linings. Fine. So, what is endometriosis? Endometriosis is the condition where one of the uterine lining, that is endometrium, it is the innermost lining of the uterus, which is affected. So it is a disease in which the tissue that is similar to the lining of the uterus grows in other places apart from the uterus in the body. These patches of tissues are called implants, nodules, or the lesions. They are usually found on or under the ovaries, in the fallopian tubes, behind the uterus, on the tissues that hold the uterus in place, on the bowels or the bladder, and in rare cases, one can also find them in the uh, like the tissue can grow on your lungs or in other parts of the body. So if the These tissue, endometriosis tissue, develops in any of the area which is apart from the endometrium, which is apart from the uterus, then the situation is known as endometriosis. Now, who are at the risk for endometriosis? Endometriosis can affect the female, any female who belongs to the reproductive age. So in India, usually reproductive age ranges from 15 years to 48 years. Okay, it varies from country to country, but in India, it is like this. Certain factors can raise or lower the risk of getting endometriosis. Now, the women who are at high risk of developing endometriosis is, if the female is having the family history of endometriosis, then it is more likely that she will get this condition. If the period started before the age 11, if the monthly cycles are very short, if the menstrual cycles are heavy and last more than 7 days. Now, the women have a lower risk of developing endometriosis if the woman has been pregnant before, if her periods started late in adolescence, and if she breastfed her babies, because in these three conditions mostly the hormonal balance is there in the body, but in the above mentioned conditions usually the hormonal balance is disturbed, which is basically a predisposing factor for developing endometriosis. Symptoms of endometriosis. The main symptoms of endometriosis are pelvic pain and infertility. Other possible symptoms can include painful menstrual cramps, which may get worse over time, pain during or after the sex, pain in the intestine or lower abdomen, pain with bowel movements or urination. Usually, the female suffers it during period, heavy periods, spotting or bleeding between periods, digestive or gastrointestinal symptoms like indigestion will be there, more acidity will be there, there will be more bloating, okay, fatigue or lack of energy. So these are the following symptoms for endometriosis. Now, how it is diagnosed. So whenever a female has a problem, she is supposed to visit a gynecologist. She'll go there. Now the gynecologist will take the family history or the medical history of that female, which is followed by the pelvic examination of the female, and the gynecologist might suggest some imaging test also for diagnosing this endometriosis. Now, the most common surgery to diagnose endometriosis is laparoscopy. Now, what is laparoscopy? It's a kind of surgery that uses an instrument which is known as laparoscope. It's a thin tube with a camera and a light. The surgeon inserts the laparoscope through a small cut in the skin. The healthcare provider can make a diagnosis based on how the patches of endometriosis look like. Now, he or she may also do a biopsy if required to get a sample. So in this flowchart, you can see the process of diagnosing this endometriosis. First, there will be medical history taken, then pelvic examination will be done, imaging test will be done, laparoscopy will be done, and if required, biopsy can also be done.